Welcome back to the next part of the unit, muscles of the legs. The first muscles of the leg is sartorius muscle, origin anterior superior iliac spine, insertion proximal end of tibia below medial condyle. Its innervation is femoral nerve L2 and L3. Blood supply branches of the femoral artery, deep femoral artery, artery of quadriceps, lateral circumflex femoral artery, then middle third because it has three heads. It received individually proximal third one, middle third one, and distal third one. Its function is thigh flexion, thigh abduction, thigh external rotation, leg flexion, leg internal rotation. You can watch the muscle which is shown in green color, its origin and its insertion. So it is attached to the pelvic girdle, and the other end is attached to the bone of the leg, that is tibia. Let us watch the video for its details.
Scalar is organizing this free workshop on introduction to Tableau. And if you are an aspiring data.
Hello again, this is Matt from KenHub, and in this tutorial, we are going to talk about the origin, insertion, innervation, and supply of the sartorius muscle. The sartorius muscle is a long, slim, superficially running extensor of the thigh musculature. As you can see, it wraps like a sash across the superior aspect of the thigh. The root sartor is actually Latin for tailor. The muscle is so called because when it does all of its jobs at once, yes, it has more than one. It's quite the multi-purpose muscle. The movement that results is a crossing of the leg in a seated position, one of the positions used when a tailor is fitting clothing. This is also when it is easiest to palpate the sartorius. Topographically, the sartorius muscle forms the lateral border of the femoral triangle, which is also known as the Scarpa's triangle, where the large vessels of the thigh pass through. For this reason, the muscle serves as a leading structure when surgically accessing the femoral artery. The origin of the sartorius muscle is the anterior superior iliac spine of the pelvic bone, and from there, it runs spirally towards the knee region. It inserts at the pes anserinus medially from the tibial tuberosity. In its entire course, the muscle is covered by a duplication of the fascia lata, which is a deep fascia that covers the thigh musculature in its entirety. The femoral nerve is the nervous supply for this muscle, allowing it to do its many jobs. The sartorius muscle is a two-joint muscle and moves both the hip and knee joint. Even though anatomically it is considered one of the extensors of the thigh, its contraction is what causes a flexion of the hip joint. This is because its insertion at the knee joint is located behind the flexion-extension axis. It is also involved in the abduction and external rotation of the hip joint. In the knee joint, it forces a flexion and internal rotation of the knee. This video is more fun than reading a textbook.
The next muscle is adductor group muscles. The adductor longus muscle. The body of its origin is body of the pubis, inferior to pubic crest and lateral to the pubic symphysis. Insertion is middle third of the linea aspera of femur. Its action is thigh flexion, thigh adduction, thigh external rotation, and pelvis stabilization. You can watch in the diagram this red, green color muscle originated here in the body of the pubis region of the pelvic girdle, and then it is inserted into the middle third of the femur region. Its innervation is through optorotor nerve L2 L4 and blood supply through optorotor artery. We shall watch the video regarding this muscle.
You know it's great for you. Waking up early, doing pranayam, practicing yoga.
Hey everyone, it's Matt from KenHub, and in this tutorial, we will discuss the anatomy and function of the adductor longus. The adductors of the hip are part of the inner hip musculature and range from the lower pelvic bone to the femur and knee region. They lie in between the extensor and flexor group of the thigh muscles. The hip adductors shape the surface anatomy of the medial thigh. This tutorial will feature one of the adductors known as the adductor longus. The adductor longus muscle has its origin at the superior pubic ramus and the pubic symphysis, and its insertion at the linea aspera. Distally, it forms an aponeurosis extending to the vastus medialis muscle and also called the vasto-adductorial membrane. The innervation is mainly supplied by the obturator nerve, which arises from the lumbar plexus and reaches the adductors through the obturator canal. Both the femoral artery and vein, as well as the saphenous nerve, proceed within a groove between the adductor magnus, adductor longus, and vastus medialis muscles. This so-called adductor canal, or Hunter's canal, is ventrally covered by the vasto-adductorial membrane. Distally, it ends between the fleshy and tendinous insertion of the adductor magnus and leads to the popliteal fossa. As the name suggests, the main function of the hip adductors is the adduction of the hip joint. Furthermore, the adductor longus supports flexion. The hip adductors are particularly used when crossing one's legs. Overall, they play an important role in balancing the pelvis during standing and walking. This video is more
Adductor brevis muscle. Anterior body of the pubis and inferior pubic ramus is the origin of the muscle. Inserted into the linea aspera of femur. Its action is thigh flexion, adduction, thigh external rotation, and pelvis stabilization. Obturator nerve L2 to L4 is innervation and blood supplied through arteria profunda femoris. In the diagram, you can see the muscle.
Hey there, it's Matt from KenHub, and in this tutorial, we will discuss the adductor brevis. The adductor brevis, or musculus adductor brevis, is one of the adductors of the hip. The adductors are part of the inner hip musculature and range from the lower pelvic bone to the femur and knee region. This group of muscles lies in between the extensor and flexor group of the thigh muscles. The hip adductors shape the surface anatomy of the medial thigh. The adductor brevis muscle originates at the inferior pubic ramus and inserts at the linea aspera. The innervation is supplied by the obturator nerve, which arises from the lumbar plexus and reaches the adductors through the obturator canal. As the name suggests, the main function of the hip adductors is the adduction of the hip joint. Furthermore, the adductor brevis supports the external rotation and flexion of the hip. This video is more
Next muscle of the leg is adductor magnus muscle. The origin of the adductor magnus muscle is from the inferior pubic ramus, ischial ramus, ischiocondylar part. It is inserted into the gluteal tuberosity, linea aspera, medial supracondylar line. It is also inserted into the adductor tubercle of the femur. Its action is adduction. It is adducted the hip joint at the thigh flexion, thigh adduction, thigh external rotation, hamstring part. At the hip joint, it is helping in thigh extension, thigh internal rotation, and entire muscle help in the pelvis stabilization. Innervated through obturator forearm or obturator nerve L2, L4, ischiocondylar part, where the tibial division of the sciatic nerve reaches through L4, and the mnemonic region, especially in the African mouse sneaks out. It refers to the adductor magnus sciatic obturator region. The blood supply is given through deep femoral artery, the femoral, then the popliteal as well as genicular arteries also provide nutrients and oxygen to the adductor magnus muscle. You can watch this muscle in the green color.
No matter how hard you work in your 9 to 5 job, at the end of the month, you'll only
Hello again, everyone. It's Matt from KenHub, and in this tutorial, we will discuss the origin, insertion, innervation, and function of the adductor magnus. The adductors of the hip are part of the inner hip musculature and range from the lower pelvic bone to the femur and knee region. The hip adductors shape the surface anatomy of the medial thigh. The focus of this tutorial will be the adductor magnus. The adductor magnus muscle is one of the biggest muscles of the human body. It originates at the inferior pubic ramus, the ischial ramus, and the ischial tuberosity, and inserts both at the linea aspera and the adductor tubercle of the medial epicondyle. The innervation is mainly supplied by the obturator nerve, which arises from the lumbar plexus and reaches the adductors through the obturator canal. The superficial part of the adductor magnus is supplied by the tibial nerve. As the name suggests, the main function of the hip adductors is the adduction of the hip joint. The adductor magnus additionally supports outward rotation, inward rotation, flexion, and extension. Overall, the hip adductors play an important role in balancing the pelvis during standing and walking. This video is more fun than reading a textbook, right? If you want more videos, interactive quizzes, articles, and an atlas of human anatomy,
The next muscle is gracilis muscle. Origin anterior body of the pubis, inferior pubic ramus, and ischial ramus. Insertion is medial surface of the proximal tibia. Its action is thigh flexion, thigh adduction. As far as the knee joint is concerned, leg flexion and leg internal rotation. Innervation is obturator nerve L2, L3, and supplied by the femoral artery. You can watch the muscle from here to the end of the femur, or it is attached to the even tibia. Watch the video regarding this
Surgical head
muscle.
transplant or a non-surgical head treatment, which is a better option? Now, in male
Hello again, everyone. It's Matt from KenHub, and in this tutorial, we will discuss the gracilis muscle. The gracilis muscle, or musculus gracilis, is a part of a group of muscles known as the adductors of the hip. This group includes the pectineus muscle, the adductor magnus muscle, the adductor longus muscle, the adductor brevis muscle, and the adductor minimus muscle. The adductors of the hip are part of the inner hip musculature and range from the lower pelvic bone to the femur and knee region. Thus, they lie in between the extensor and flexor group of the thigh muscles. The hip adductors shape the surface anatomy of the medial thigh. The innervation of the gracilis is supplied by the obturator nerve, which arises from the lumbar plexus and reaches the adductors through the obturator canal. The gracilis muscle runs from the inferior border of the pubic symphysis to the superficial pes anserinus onto the tibia. Its tendon is easy to palpate in the inguinal region, together with the tendon of the adductor longus muscle. As the name suggests, the main function of the hip adductors is the adduction of the hip joint. Furthermore, the gracilis supports flexion. As the only two-joint adductor, the gracilis muscle moves the knee as well, where its contraction causes a flexion and internal rotation of the knee joint. The hip adductors are particularly used when crossing one's legs. Overall, they play an important role in balancing the pelvis during standing and walking. This video
Next name of the muscle is obturator externus muscle. Its origin is anterior surface of the obturator membrane, bony boundaries of the obturator foramen. It is inserted into the trochanteric fossa of the femur. Its action is regarding hip joint, thigh external rotation, thigh abduction, stabilizes head of the femur in acetabulum. Innervation L3, L4 through obturator nerve and blood supplied through obturator and medial circumflex femoral arteries. We can watch the muscle in green color.
At some stage or another, most of us often find ourselves sitting with our legs crossed. Whether it's catching up with your girlfriends or just hanging out with the guys, it's just a comfortable way to sit, right? To perform this action, we must be able to externally rotate our thighs. Today we'll learn about a muscle that assists in this movement in our tutorial on the functions of the obturator externus muscle. Let's begin with an overview of the anatomy of the obturator externus muscle. As we can see from our anatomical model here, the obturator externus is a flat fan-shaped muscle that originates from the external surface of the pelvis. Therefore, we can best see it from an anterior perspective. Looking at the bigger picture, the obturator externus muscle is part of a group of muscles known as the external rotators of the thigh, or the hip joint, which gives us a clue about its function, but more about that later. Alternatively, you might also sometimes see it classified as one of the muscles belonging to the medial compartment of the thigh. In order to understand the functions of the obturator externus, we need to first learn about the bones it attaches to and the joints that it crosses. If we take a closer look at our awesome 3D model here, we can see that the obturator externus muscle originates from the anterior surface of the obturator membrane and the bony boundaries of the obturator foramen. Its muscle fibers converge posterolaterally to form a tendon, which passes posterior to the neck of the femur to insert at the trochanteric fossa of the femur, which is this depression we can see here if we view our model from a posterior perspective. By looking at these attachment points, we can clearly see that the obturator externus muscle crosses just one joint, which is, of course, the hip joint, also known as the acetabulofemoral joint. So now that we know the anatomy of our star muscle, we also need to have a look and see what nerve instructs it to carry out its functions. Conveniently, the obturator externus is innervated by the obturator nerve, which is formed by the L2, L3, and L4 nerve roots of the lumbar plexus. Specifically, it is innervated by the posterior branch of this nerve. Now that we're familiar with the structure and innervation of the obturator externus, let's move on to talk about its functions.
This video is not over yet.
So the students, we have finished this unit in the form of video. I have shown you all the muscles of our hand as well as leg. So we have divided this unit into three main part: the muscles that move our forelimb, particularly the upper arm, the muscles that move our forearm, and that move our wrist, as well as the muscles which are helpful in moving our leg or the part of the bones of our legs. So thank you very much for your patient listening. So all the best for your exams. Go through this video by slowing down this video and see those videos I have shown you, internal videos shown you, gives you more idea about the location, about the origin of the muscle, about the insertion of the muscle, as well as the nerve innervation and the function of the muscles. Thank you very much.